Hello, everybody. My name is CKing. I'm an LVN. I am a student of Indiana State University in the Community Health Nursing course. And today we're going to be doing a health education program that I'm really excited about. Yes, this is my natural voice. I've had many surgeries throughout my life with throat reconstructions, so I will try to speak as clearly and concise as possible. So let's get started. All right, so actually what we're going to be talking about today is patients with multiple chronic care conditions and the importance of chronic care management programs. So some of the learning objectives that we're going to be doing is understanding the importance of chronic care management programs and how it relates to healthcare costs and improving overall health. But at this time, if you like, I would like for you to take the pre-test. Don't cheat and look at the post-test answers. Wait for that till the end. And I have provided a link for you down below here. So topics that we're going to be covering is how Americans are impacted with chronic care conditions, the importance of the chronic care management programs to reduce the health costs, improve health, and reduce things like ER visits, hospitalizations. And I'm also going to be talking about my observations with multiple chronic condition patients and how I've been doing it in my clinicals. So how many people does this affect? Believe it or not, 1 in every 4 person has multiple chronic care conditions. Um, and not only that, 66% of our total healthcare costs are due to Americans with multiple chronic care conditions. And that is a shocker. Oh my God. I couldn't believe when I first saw those numbers. So leading to the managed care, or I'm sorry, multiple chronic conditions. Um, which do you, which two chronic conditions do you think actually impact healthcare the most? I thought it was diabetes and heart disease, or diabetes and dementia, things like that. Believe it or not, high blood pressure and high cholesterol. That's a shocker to me. I can't believe that diabetes is only 28%. So, how do I identify patients with multiple chronic conditions when I'm at my clinicals at ADC, Austin Diagnostic Clinic? So there's a few ways that we do it. Of course, the providers tell the patients about the chronic care management program, and those patients are either relayed to us or the provider tells us and we contact the patients. The other way is actually, which I love, is ADC is contracted through several different insurance companies. Two of the biggest is Humana and Aetna. And what they do is Humana and Aetna send reports to ADC on a daily, weekly, and monthly basis. And so what we do is we gather that data and we put it in a report. Excuse me. And what we do is we determine on which patients are high risk, high cost, HRHC. And what we're going to do is put those in a particular pool, and then we go to medium risk patients and then low risk patients. So for the high risk, high cost patients, we're going to contact first, and so on and so forth. I really like this program. I really like that they work with the insurance companies to help utilize healthcare for these chronic conditions for these patients. Initial consultation with the patient, we do several things. Um, First, I'm going to ask the patient how they view their condition. This is important to me because I want to know where their mindset is on do they think they're doing okay? Do they wish that their health was better? So on and so forth. The other thing I want to know is their goals. So has a patient just given up and doesn't want to do anything? Do they want to do things like stop smoking, increase exercise, make their diet better, things like that? I want to know where the patient's mindset and goals are so I can help them create a great, plan to fill in those gaps of care, um, that are making them sick. Um, I also need to know what their barriers to their care is. So here in Texas, a big one is a language barrier. But I also need to know, is it a socioeconomic thing? Do they just not know anything about their current conditions? Um, I just need to know what is going on with this patient so I can make a better plan for them. And then finally, I also want to know what their support system is. So I need to know, are family members involved? Do neighbors help out? Are they a part of a community program? Things like, smoking cessation programs, things like that. So I gather all this information in my initial consultation, which usually takes about an hour with the patient. And then I build a plan from there. I coordinate with that patient's healthcare team. So I need to know, do they have multiple specialists along with their primary care? Are there gaps of care with all of those specialists? For example, one time I saw that the endocrinologist ordered something for their insulin, but the primary care did another order for their insulin, and they were completely wrong doses. I also want to get the family involved. So I want to know what is their family support, like I said earlier. And I kind of want to get them involved in helping out this patient. So whether it be, the son challenging the mom for an exercise plan, or, things like that. And then if applicable, I need to get the community involved. So here's the healthcare team, here's the family, and here's the community. So the community is also very important, as we've been learning. Um, Things like Meals on Wheels, YMCA, prescription coverages, free health clinics, things like that. I want to get this patient as involved as possible in these community programs because there's a lot out there. I just learned that there's tons of programs out there that we can help utilize and nobody's really using. So, like I said, I'm trying to bring everything together as a holistic. And then finally, I'm always evaluating the patient. I'm evaluating them, weekly at first with their initial consults, monthly, and then as needed. So with the initial consults, for the first 4 weeks, I like to follow up with them either once a week or every 2 weeks, just to make sure that we're going in the right direction. After that, once I have the patient on a good plan, I usually do about monthly follow-ups, 4 to 6 weeks. And then, of course, as needed. So let's say something happens with a patient's plan of care, or there was another condition that has been added to their problems. I need to know about this, and we need to help adapt that patient's plan as best as possible. What I'm doing with reevaluating is I'm rechecking those reports. So those reports that I get from insurances and doctors actually give me a lot of information on how many hospital visits there are, if they are filling their prescriptions, things like that. I'm also checking in with their healthcare team every once in a while to make sure that everything is working together. And finally, it's all about being proactive and not reactive with this patient's care. Thank you all for listening to me today. I've had a lot of fun with this subject. I'm very passionate about this now. Chronic care management is a very vital part of a patient's needs. I hope you've learned a lot with this. I hope this encourages you to go out there and really be part of a chronic care management team. Y'all have a great night. Thank you, guys.